Hi, welcome back. I'm Dr. Mahoney again. Today we're going to be talking about understanding your spine and disc pain, understanding what's the root cause of the things that you're dealing with. So we're going to talk about some of the most basic things today. We're going to talk about some of the anatomy. We're going to talk about the disc. We're going to talk about why a person may feel pain and how a disc can get to that point, okay? So when we go through this, when we look at a spine, it's made up of 24 movable bones. They're called vertebrae. Each of those vertebrae are separated by a disc space. The discs are supposed to stay open, wide, healthy. They're hydrated, they separate the vertebrae. They create a space back here. It's called the intervertebral foramen. That hole back here allows the nerve root to come out, go to different parts of the body. It travels down through the spinal cord, out through these nerve roots, to our legs, our feet, everywhere. So what happens due to traumas, different stresses in our lives, these vertebrae will start to squeeze on this disc, causing it to be unhealthier. So when we take a healthy vertebrae, two bones, the disc space in between, we look at it from this view, you'll see the inside of the disc space is called the nucleus pulposus. That's where all the minerals, all the nutrients are stored. It acts as a shock absorber for our spine. Around the outside are called the annular fibers. These annular fibers keep the nucleus inside, keep the spine healthy. What happens from different traumas, whether it's an auto accident or sports injury, poor posture, or just degeneration over time, the annular fibers will start to break down, they'll start to weaken, the nucleus will start to bulge or herniate. When that nucleus starts to bulge or herniate, it could be straight back and affect both sides. Typically, it's going to be to one side, it's going to start to bulge and herniate out, affecting the nerve. I'll show you an example of what that looks like. So we look at this model. What we're seeing is the vertebrae. In between the vertebrae is the disc space. From this view, you can see the spinal cord coming down the back of it. These bones back here are called facets. When the disc space gets narrow, the facets can start to rub together, and some people say, I have facet joint pain. That can cause pain. That's usually one of those slower, chronic pains people deal with. The other kind of pain could be that one that came on and hit you really quick. That's when a disc will start to bulge or herniate. What happens is the disc space inside of here, when that nucleus bulges out, say kind of like that bulge will start to affect the nerve. Wherever that nerve goes, whether it's your buttock, your leg, your foot, you're gonna feel some type of abnormal sensation. It could be pain, it could be burning, tingly. In chronic situations, it'll become numbing or the loss of ability to walk. When a patient gets like this, there's many different options. Some might work, some might not work. Some patients will do physical therapy, muscle relaxers, painkillers, maybe epidural injections, or be told they need surgery. We do things a little bit differently. We do things non-invasive, natural. We do a technique called spinal decompression therapy. When you come into our office and we decide you're a good candidate, spinal decompression is gentle, it's safe. You'll lay on a table, very comfortable. It's computerized. What it will do is we'll take the area of disc herniation, it will gently begin to stretch that area, reabsorbing that disc material back into where it's supposed to be, take the pressure off the nerve, making your leg, your back feel pain-free. I'll show you another example of how that would look. When you take this model and you have a disc bulge or herniation, when we begin to separate the vertebrae through spinal decompression, it starts to take the pressure off there. Eventually, for good, no more nerve pain, no more back pain, feeling so much better. So spinal decompression actually saved my career, saved my life, after I had a pinched nerve. It saved thousands of our patients' lives, made so many of them feel so much better. We do it every day in our office. We've been doing it for over 15 years. We love it. If you want to try it, reach out to us. Hopefully we can help you. So listen, I hope you enjoyed this video. Have a great day until next time. Take care.